The question that I have for you is, what is racism and how does it manifest itself in research?
So, of course, racism has multiple definitions, but the definition I'll offer up today is that racism is an ideology, a structure, process involving systemic subordination of members of targeted, socially constructed racial or ethnic groups. Racism operates within and across systems and institutions at interpersonal levels and is internalized. For mental health research, whether it is your topic of your research or not, the reality is that racism is historically embedded in the foundation of all systems and institutions in which we work. It's embedded in the economic and the social foundation built through colonialism and slavery. Racism, importantly, is a life course exposure that is often witnessed, experienced, and anticipated from a very young age. For many of us, racism is the earliest and most pervasive exposure to adversity, manifested often through prejudice and discrimination. And so I also want to importantly note Dorothy Roberts, Professor Dorothy Roberts, Professor of Law and Sociology at University of Pennsylvania, recently made this comment on Twitter. Racism, she says, quote, "Racism isn't the product of race. Race is the invented product of racism." And in terms of the way that it manifests itself in research, that happens in a number of ways. So racial inclusion in mental health research continues to be elusive. There are apparent gaps in race-related research, a disproportionate lack of funding on race-related research, especially before the pandemic, and also apparent in how race-related research is conducted, the scope of the research, the interpretation and contextualization of the research, and how we are incorporating this research into our teaching. And in fact, at the beginning of the pandemic, many of us were surprised, not including myself, because it's something I've been going on a lot about how little we actually knew about the mental health inequalities affecting racial and ethnic minority groups. So where was the evidence when we needed it? So it's important to look to the past and think about how we got here. And it's one of the things that is striking to me is that the last comprehensive nationally represented survey of racial and ethnic minority mental health in the general population in the UK was conducted nearly 2 decades ago. And that was the Empiric study. So importantly, that study had an ethnic boost sample to deal with the lower sample size, but it did not present findings for substantial racial and ethnic groups in this country, such as those who identify as Black African. So we've been relying on detailed mental health data from the Adult Psych Morbidity Survey, which requires us to pool data across all racial and ethnic groups. And even when the data is pooled, it can't examine important areas and mechanisms. As a result, we rely also heavily on electronic health records, which represent those who have been in contact with services, but is limiting our understanding in terms of the level of need in the general population. We are fortunate that we have several high quality qualitative research studies, some conducted by my fellow panel members, and I hope that they'll go on to talk about that. I also want to say that it manifests itself in terms of the training and education pipelines. It's evident in the limited opportunities for students and trainees to conduct race-related research. It limits career progression in terms of mental health research. We've seen a loss of talent in some cases and poor retention. And I also want to note just recently, recent related reports, such as just recently on BBC Newsnight, but more importantly, detailed in the Leading Routes report entitled The Broken Pipeline, showing that Black applicants for PhDs were much less likely to be offered studentships, among other disturbing disparities. So to conclude, it should not be okay that we don't know the level of mental health need of specific racial and ethnic groups in the general population. It should not be okay that there has been a relative lack of investment in race-related mental health research to address this gap in our knowledge and evidence. And it should not be okay that we are basing recommendations for policies, interventions, and services on evidence from mental health research that does not adequately represent racial and ethnic minority groups. Thank you.